If you're pregnant right now, scrolling at 2 a.m. after another appointment has left you feeling anxious, or maybe your child is already here, but they're struggling with colic, their reflux, sleep issues, or sensory challenges. And this video is really going to shake some things up for how you view and manage their health and actually when the problem started. Most parents never hear that the American pregnancy experience, with its constant monitoring, testing, and fear-based mongering, creates chronic stress that doesn't just affect you, but it directly programs your baby's developing nervous system. And this isn't about guilt. It's about understanding what happened so that you can understand what your child actually needs. This video is for you moms who are fully stressed out, anxious, or overwhelmed during your pregnancy journey and wondering if it's actually affecting your baby. And it's for parents whose children currently struggle with colic or reflux, sensory issues, or developmental delays. We're going to dive deep in understanding what nobody is addressing. Now, to put this into a larger perspective, your great-grandmother probably had 4 or 5 prenatal appointments during her entire pregnancy. No routine ultrasounds, no genetic testing, no glucose challenges. Today, you're having 12 to 15 routine appointments, and that's if you have a normal, healthy pregnancy. You've got tons of ultrasounds, various blood draws, glucose tolerance tests, the non-stressful tests that label you high risk, and this constant monitoring that sends a very clear message to you. Something could be wrong at any moment. See, birth has moved away from this natural perspective that midwives once ruled and controlled within the birthing community, and it's been pathologized. It's been turned into a medical diagnosis and a disease, in which the only woman or only person at that in a hospital without a disease is a pregnant patient. But this has drastically changed over the course of the last several decades. In 2017, there was a study that was published in Developmental and Psychopathology, and it tracked moms and children throughout their pregnancy through age 6. Well, the findings showed that babies born to mothers with high prenatal stress showed nervous systems that were 22% more reactive at 6 months old. These babies showed 8% lower self-regulation capacity and a greater risk for anxiety and depression as they aged. 22% were more reactive. Therefore, they were unfortunately created this way due to the pregnancy stress that is going on in our society. Now, when you measure the experience of stress with pregnancy, it's not just emotional, it turns into a biological manifestation. The HPA axis responds to stress directly by releasing cortisol. These short bursts of cortisol can be normal and are expected, but chronic elevation from constant appointments, these test results show that we need to watch this messaging pattern. And it becomes a problem because the placenta has a protective enzyme that converts active cortisol into inactive cortisol before it reaches your baby. But during a stressful situation, chronic stress, we're not talking about acute episodes, emergency situations, but chronic nonstop stress during pregnancy, that barrier goes away. And active cortisol crosses the placenta and reaches the baby's developing brain. Now, the baby's baseline normal is being programmed based off of your nervous system state. And that's the beauty of the umbilical cord. It's more than just nutrient delivery. It's the power cord that literally connects both mom and baby. It carries signals from your nervous system directly into your baby's developing nervous system. So it learns its environment based off of its perception of stress that mom is feeling. So moms, when your nervous system is stuck in fight or flight mode, those signals transmit to your baby. And your baby's brain structures form in a stress-adapted pattern. The amygdala, which is the fear center inside the brain, develops larger and more reactive. The vagus nerve, which forms with low tone, it affects the regulation of heart, lungs, and digestion, along even with emotions due to that parasympathetic involvement. And it is not just genetic. It's the nervous system programming during the most critical developmental window while that baby is still growing inside the womb. Prenatal stress affects the very specific brain structures that control everything from emotional regulation to academic learning. Babies startle easily and struggle to calm down because their amygdala is overreactive. Learning these emotional regulations suffered because the hippocampus cannot reduce its volume. Controlling emotional responses become harder due to the altered prefrontal cortex connectivity. And the vagus nerve, well, it's responsible for calming the entire body, and it develops with low tone. These neurotransmitters form for serotonin and dopamine establish this stress reactive pattern. And yes, your baby is born into this very nervous, sympathetic dominant environment that's been created since they were being programmed in utero. Now, prenatal stress affects very specific brain structures that control. Now, if your child's nervous system is stuck in fight or flight mode, and it's from the prenatal stress and the prenatal programming, their body physically cannot digest properly, can't sleep deeply, can't regulate emotions, fight off infections effectively, or calm down when being upset. You can do the dietary changes. You can take supplements, use behavioral therapy, sleep training, occupational therapy, great options. All of these can help, but if the foundational nervous system function is not addressed, you're building on a cracked foundation. Neurologically focused chiropractic care addresses the stress within the nervous system that's created from the prenatal complex. We use very specific technology that identifies the sympathetic dominance, and it aids in understanding where to place very gentle, very specific adjustments that aim to really balance and stimulate that nervous system. And once we remove the interference and restore neurological function, the body's healing capacity starts to emerge. So whether you're still pregnant and want to support your baby's developing nervous system currently, or if your beautiful child's already here but they're showing signs of dysregulation, the path forward is the same. Address the nervous system at its foundation. The perfect storm started before birth, but understanding what really happens is the first step moving forward to give you some answers and to give your child's nervous system what it actually needs. Click on our link in our bio below. DM us or schedule an appointment directly with Maximize Chiropractic in Sacramento. I look forward to serving you and understanding this health journey that's been affected, whether it's through a stressful pregnancy, through interventions with your birth experience, or if you're just observing that your baby is just not regulating their function and performance like they should. We can really help to create some healthy momentum and give you the answers that you're looking for.